Looking at the social aspects of persons who are above 60, what would you say are the key issues that are affecting, our fathers and our mothers in their sunset years?
Loneliness. And the truth is, loneliness will send you to the grave faster than any medical condition.
There's an interesting aspect that you had shared about involving them in physical activities and in sports. How do you anticipate to roll out this kind of involvement?
Looking at it, after the age of 30, we lose 3 to 5% of our muscle mass. So it gets to a point, this is 30 years later, so it gets to a point where it is use it or lose it. And at this point, physical activity, like I like to say, is one drug. If I could put in a capsule, I would package it in a capsule and give it to everyone for free, because it has very many benefits.
Yeah.
So looking at that, there is an action plan on physical activity, which is a national action plan, and it speaks to all ages, including older persons. Number 2, there are community projects and community groups that are doing very well, whom we work with, that are doing very well at this. For them, they have 3 days of physical activity every week, and they get to enjoy, they get to socialize, they get to improve their health, so people get less lonely. I also keep saying, it's never too late to learn. You can learn to dance at 60.
How about how will culture incorporate it? Having this vision of, after retirement, my mom is, heading out to the gym on Tuesdays, Wednesdays, and Thursdays. Whereas culturally, you find that most people will either tend to have an activity, the men will go hang out with their colleagues, the women will tend to have the chamas in church to fill in, that gap. How do you anticipate to deal with this cultural issue?
First is to demystify the fact that physical activity is equivalent to the gym. It is not. Mm-hmm. So the physical activity could actually be happening within the chamas, where the men go to meet. You could have your yoga classes, your walks in the evening, when you're going to the shamba to look at your cows and sheep, if you're in the village. If you're in town, you can walk along the streets around your neighborhood. Mm-hmm. Yeah, so it doesn't have to be in the gym.
And looking at sexual health amongst people who are above 60 years, what are some of the key issues? And do you feel that there's a gap in how their sexual health is handled?
Definitely a very big and actually a very huge gap, because again, these are needs that both male and female have. Number 1, when you're talking about let's say, for example, protection of sexually transmitted infections, we will talk to the youth. But are the youth the only people who are engaging in sexual encounters? Probably not. So why don't we talk about the same prevention to the older people? And then again, when you talk about sexual and reproductive health, when does somebody cease being a woman? You're a woman until you die.
When you die.
Exactly.
Yes.
When does somebody cease to be a man?
When they die too.
Exactly.
Yeah.
So those are issues that need to be taken care of and need to be addressed. And the stigma around it in the public needs to actually be acknowledged and addressed appropriately.
Yeah.
Because again, as long as there's stigma, no action will take place.
But who will address this gap? Because I think it's also going to be in an interesting scenario where you have a daughter or the parents saying, hey, I am having these concerns, or you have a woman who's above 60 having a reproductive health issue but can't share it with the daughter or son who's almost like their caregiver at that age.
And that is why we need to strengthen the health component of it.
Yeah.
And encourage the older men and women to seek health services and appropriate health advice.
Yeah.
Because again, if you have an issue and keep quiet with it, we will not know and will not be able to sort it out. So that means we need to talk about it and also work on our health-seeking behavior.
Yeah.
As in, get the right treatment and management from the right place. Yes.
Oh, okay. And as we conclude, in the next 5 to 10 years, paint a picture of how you'd want the life of a 61-year-old man or woman in Kenya to be. What are your aspirations?
Number 1, retirement is not end to life. It's just another beginning of another chapter of life, where now you're free to explore all the things that you could not have explored because you are paying my fees. Yes. Learn to dance, volunteer, because again, at 60, you have a lot of experience to just go sit in the house. So I want to see these people volunteering. You wanted to know how to swim, but you could not. It's an opportunity to do that. Dance, the things that you could not have done earlier in life, it's an opportunity to actually get into them. And saying, I'm too old to learn, it's actually an excuse to not live this life and not to live a healthy life at that.
Okay, thank you so much. And we have it there. Age is not an excuse not to live a healthy life. Thank you for watching Wanja's Health Diary.